So, do you find yourself waking up night after night, staring at the clock at 3 a.m., needing to rush to the bathroom? Look, you are definitely not alone. It's called nocturia. And while it's incredibly common as we age, it's also a signal from your body that honestly deserves some attention. Today, in this explainer, we're going to explore exactly why this happens, what it means for your health, and most importantly, how you can reclaim your sleep and your peace of mind.
It's an absolutely exhausting cycle, right? But I really want to reassure you that this isn't just some quirky habit you have to just live with. Your body is trying to send you a message. Waking up to pee is incredibly disruptive to your rest, for sure, but understanding the mechanics behind it, that's the very first step to fixing it.
So, what exactly is nocturia? Well, the medical definition, at least according to the International Continence Society, is simply the need to wake up at least once during your main sleep cycle to urinate. The key takeaway here is that nocturia is not a disease in itself. It's a symptom. It's a sign of something else going on in your body. Okay, let's dive into this. Think of your bladder as a storage tank and your kidneys as the supply line. Nocturia is kind of like having the supply line faucet left on just a little too high. It causes the tank to fill up and overflow, right when the factory is supposed to be completely closed for the night. So you either have way too much fluid coming in or a tank that just can't hold enough. Section 1. The simple supply problem. Let's look at behavioral causes. Let's investigate the easiest fix first. Many of us really don't realize how much we're actually consuming in the evening. If you're having a pre-bed herbal tea or a glass of water right before hitting the pillow, your kidneys are going to process that fluid while you sleep. But it's not just water. High dietary salt and even high evening protein can increase your nighttime urine production. And then, of course, there are the outright diuretics, like alcohol and caffeinated beverages. These actually stimulate your bladder and artificially crank up your urine volume. Because here's the thing, when you consume these diuretic fluids, you're virtually guaranteeing increased urinary symptoms within 2 to 4 hours. So having that nightcap or a late evening cup of decaf coffee, and yes, even decaf has some caffeine and acids, creates a simple supply and demand issue while you're trying to sleep. By shifting your fluids to earlier in the day, you give your body a solid chance to process that water before your head ever hits the pillow. Section 2. Aging and your body. Let's examine biological and hormonal shifts. Now, what's really interesting about this slide is just how incredibly common this biological shift is. Let's say you've already cut out evening fluids and you're still waking up. It's vital to know that this often isn't your fault. Over 50% of adults over the age of 50 experience nocturia. It affects both men and women, and the prevalence literally only increases as we get older. Here is the biology behind it. Our bodies produce an antidiuretic hormone, or ADH, which normally tells our kidneys to slow down urine production at night. But as we age, we often produce a lot less of this crucial hormone. Because this natural circadian rhythm gets blunted, your kidneys just continue working at a daytime pace, even when you are desperately trying to rest. It's a natural biological shift, just how the body naturally evolves over time. Section 3. Uncovering hidden medical triggers, investigating prostate, bladder, and systemic issues. Moving beyond age and diet, we really need to investigate hidden structural and systemic medical conditions that could be disrupting your sleep. Now, for men, a highly common factor is prostate health, specifically BPH, or benign prostatic hyperplasia. This is basically just an enlargement of the prostate. When it enlarges, it can press on the urethra, making it really difficult to empty the bladder completely. And think about it. If you aren't emptying your bladder fully during the day, it's going to fill up much faster at night, leading directly to those midnight bathroom trips. This is something urologists treat every single day with great success. So the crucial point is, could your breathing actually be the culprit? It's not always a plumbing issue. Sometimes it's a breathing issue. Here is something most people don't know. Obstructive sleep apnea can actually trigger nocturia. Let's walk through this fascinating chain reaction. With sleep apnea, your airway closes momentarily. When you struggle to breathe, your respiratory muscles produce negative pressure in your chest. This causes your heart to work much harder. In response to this mechanical stretch, your heart releases hormones, specifically atrial natriuretic peptide, that actually inhibit your antidiuretic hormone. So they're signaling the kidneys to produce more urine. It's an incredible, complex, internal domino effect. If you snore loudly or feel tired during the day despite getting a full night's sleep, It is absolutely worth discussing sleep apnea with your doctor. Studies show that treating obstructive sleep apnea with CPAP therapy can drastically improve or even completely eliminate the need to pee at night. Why? Because it stops that hormonal chain reaction right in its tracks.
Section 4. Taking back your sleep. Let's focus on actionable lifestyle management. Knowing all of this, what can you actually do today? Let's shift our focus to the simple, practical steps you can start taking right now to manage this and take back your sleep. First, start by keeping a bladder diary for 3 days. Note exactly what you drink, how much you drink, when you drink it, and how often you get up to void. You can even use a measuring container. This diary is an incredibly helpful tool because it identifies your personal patterns and provides critical data for your doctor to categorize your specific type of nocturia.
And this brilliantly illustrates that fluid management isn't just about what you drink, but where the fluid sits in your body. Beyond restricting fluids 2 hours prior to bedtime, consider elevating your legs in the late afternoon or wearing knee-high compression socks. As we age, fluid naturally pools in our ankles during the day. When you finally lie down to sleep, that fluid returns to your circulation and your kidneys process it straight into urine. By elevating your legs or using compression socks earlier in the day, you help that fluid return to your bloodstream so your kidneys can process it before you ever go to bed.
Along those same lines, here is a surprising lifestyle hack: taking a daily afternoon nap. Resting horizontally during the day allows your bloodstream to absorb that pooled liquid earlier, so you'll wake up from your nap and need to use the bathroom, which redistributes that fluid during daytime hours rather than interrupting your main night's sleep.
Section 5. When to see a doctor. Exploring medical interventions. Let's move to and see how this builds. If lifestyle changes aren't quite enough, when should you actually seek professional help? The simple answer is when your quality of life is suffering. You do not have to just tough it out. Notice this structured clinical algorithm from the European Association of Urology. Medical providers use this to systematically rule out underlying issues. When you bring in that bladder diary, they use it to check for things like infections, diabetes, or prostate issues, and they can pinpoint exactly whether you're dealing with nocturnal polyuria, a bladder storage issue, or a mixed disorder. Once that root cause is found, doctors have highly effective treatments available. For example, for men experiencing nocturnal polyuria, guidelines support using low-dose antidiuretic therapies, like desmopressin, to safely reduce nocturnal urine output. However, pay attention to the strong recommendation regarding sodium levels. They must be carefully monitored, especially in older adults, to prevent hyponatremia. There are also medications to relax the bladder or shrink the prostate. Basically, the medical toolbox is large. It's also vital to watch for red flags. If you experience daytime fatigue, pain, blood in your urine, or sudden changes, please see a provider. Waking up at night shouldn't just be ignored, especially because nocturia is linked to a massive 25% increase in nighttime falls among older adults. We want to keep you safe and well-rested. There are medications, lifestyle adjustments, and therapies that can make a massive difference in how you feel each morning. You truly deserve a full night of restorative sleep. If you're tired of being tired, make an appointment with your primary care provider or a urologist and bring that bladder diary with you. It's a small step that leads to a much better quality of life. So I leave you with this question. What small step will you take tonight to reclaim your rest? Will it be putting on compression socks, skipping that evening tea, or maybe calling your doctor? Thank you so much for joining me for this explainer today. Take care of yourself, sleep well, and I look forward to seeing you next time.